Hi everyone, so I'll be starting off with my presentation for my Practicum project final submission. My name is Sharik Nadeem and my application is called Chronic Illness Self-Help Portal. So the project goal and requirements. The project basically involves creation of a comprehensive self-help portal for patients suffering from chronic conditions and or are undergoing treatment for the same. The portal will include resources and information related to a variety of aspects that can facilitate improving the quality of life during the course of the disease and its treatment, such as diet, exercise, audiovisual resources, counseling, etc., and also some other interactive modules. And those will leave the patient well informed and well prepared for the condition as they try to improve their lifestyle through the course of the illness. They don't have to rely on visiting specialty services or exploring multiple avenues, as everything would be available under a single roof. The user requirements for the project are basically the portal should allow registration for both patients as well as providers. The portal should include support for multiple classification and types of chronic illnesses. The interface should be clear, easy to read and understand, and intuitive. And the functional requirements obviously would be the different modules that will be available within the application itself. Those would be announcements, notes, diet, virtual appointments, multimedia resources, information resources, and counseling. Coming to the team roles and contributions. So this was an individual project and all aspects of the project were accomplished by me, including research, design, data modeling, coding, integration, testing, bug fix, as well as the final deployment. As a side note, this was my first experience as a developer. I've worked all my life as a system engineer, so learning Python throughout the course of the program was something that I took up eventually to create my final Practicum project. So there were three key areas that I did research on, the first being industry problems. So chronic illness patients face many roadblocks within the current care delivery model for chronic illnesses. Some of them are doctors' clinics are often distant, have limited after-hours availability, and lack cultural and language accessibility. Patients with chronic conditions usually require long ongoing face-to-face interactions with a physician in order to manage their conditions. These are usually spaced 3 to 4 months apart for well-controlled patients, and each requires the patient to spend few hours in a doctor's office as well. So adjusting their jobs and family lives for an effective 10 to 15 minutes of personalized interaction is definitely not helpful. Appointment scheduling processes for most providers is limited to 15-20 minutes for every follow-up visit, regardless of the patient's comorbidities or communication barriers. And lastly, with the fast-paced setups and focus of billing that providers have, providers often do not deliver value concordant care or assess a patient's barriers to initiating or maintaining behaviors that would maximize their quality of life. The next area was about the gaps in the domain. So in that, patients have a severe knowledge gap. That is, they do not know their chronic conditions well enough and have limited to absolutely no understanding of the treatments being given to them. There is an increasing amount of mistrust between chronic illness patients and providers. As their conditions last for long periods of time and with limited cures to common chronic conditions, patients over a period of time develop a feeling of whether the providers are really invested in their well-being or not. Long gaps between follow-ups definitely adds to the sentiment. Next, there is very little scope of feedback from the patient to the provider when it comes to chronic condition management. Most traditional treatments follow a set pattern and the outcomes fall into established buckets, which leaves little room for patients to have a say about their condition or response to the ongoing treatment. Lastly, self-management for chronic illness, though has improved over the years, still most models and platforms cater to a single kind of illness or a single kind of self-care offering. There are not many avenues which provide a one-stop shop for multiple chronic illnesses that patients can utilize and that would help them to improve their lifestyles in general. Lastly, the research that I did was end user perspective. In my case, that was analyzing user conversational data. So there have been many research over the years to find out the barriers in chronic self-care management, wherein chronic patients have been interviewed with interactive questions that aim to establish the viewpoint of the patient and also define what would effectively constitute self-care in this particular area. So for my research purpose, I am citing, and I did utilize this research, which is an existing research published in the Journal of Nursing and Healthcare of Chronic Illnesses. And they had sampled conversational data for 42 men and women living with chronic illnesses. And the results were pretty fascinating. Self-care is a process of adaptation and response to learning about oneself and about ways to live with the illness. And developing capacity to self-care impacted significantly on the way participants experienced their illnesses, their view of themselves, and also the view of their future. The conclusion of this research was that people with chronic illnesses described the process of self care management as transformational in terms of feelings about their selves uh, and reclaiming a sense of order. It enables them to move forward with a sense of the future. The primary healthcare principle of holistic assessment, taking account of the wider context of people's lives, is of utmost importance when educating about self care. And how was this research relevant to clinical practice? Well, healthcare workers can assist people by acknowledging that chronic illness self care is a process that gradually evolves and is born out of listening to a person's priorities and finding ways and strategies to fit harmoniously alongside those particular priorities. So these were some of the researches that went into me coming up and conceptualizing this particular project of mine. Next, we'll take a quick look on some of the screen grabs from my actual application in action. Some of the key features are dashboard and notes, virtual appointments, recommended diet plans and supplements, media center, information hub, and counseling. Now, before we jump into the final status and Gantt chart, we'll take a quick demo of the actual application itself. So this is what the login screen looks like. Of course, it has a functionality to create a new account and retrieve password if you've forgotten. I do have a registered patient that I'll be using for demo purposes today, just to save some of the time. But yeah, you can register as a patient or a provider. So as soon as we come onto the landing page, we see that the dashboard or the notes section has published information from different providers. And these are basically common to all patients for a particular illness. And the one right here is from a psychiatrist. It gives us some tips about how to manage mental health for diabetes type 2 patients. And the next one is from Deborah Hill, who happens to be a trainer. This is about how or what sort of exercise can be taken up by patients of type 2 diabetes. Another module that we have is virtual appointments. Basically, what the patients can do here is book new appointments with the list of available providers, and they can choose any provider that they want. They can choose the date and timeline, and just mention what the appointment is for and book the appointment. It shows within the list of virtual appointments. Of course, once they make the appointment, a notification would ideally go out to the provider for a more customized and patient-centric experience. Another module that we have is diet and supplements. So basically what it does is it gives you a preset recommended and specifically designed diet plan and supplement plan for that particular illness. And patients are free to include those in their day-to-day lives. If they don't like it, they can always go ahead and create one of their own by clicking on this link. This link basically takes them to a publicly and freely available meal planner for different kind of diseases. Once we have a live working website, public facing, we could probably have more third party partner with us, and we can provide the links for those as well. Then there's the media center, which has video and audio resources for the particular disease that the patient belongs to. They don't have to search information. Everything will be curated according to their needs and would be readily available here for them to view and listen to. The next information hub, this is again so that the patient becomes much more well informed about their disease, their condition, and the treatment that's been given to them. They can click the different links that are available here and browse the information resources that are available. And lastly, this is a very neat feature. We talked about counseling. So chronic illnesses over the years have seen a rising number of cases wherein patients end up having some sort of stress, anxiety disorder, mental disorder, so on and so forth. So if a patient feels that they fall under this bucket, they can utilize this module, and by clicking here, they would be redirected to a list of professional providers who help with these services, find a provider of their liking, and make an appointment. Again, when it comes to a live functional production website, yeah, this would be one of our registered third partners that will be redirected to. The cool feature is this notifications icon. And this basically includes any social outreach, public events, or community service events that are available for the patient of this particular disease. And here it says, welcome Billy, check out the below announcement. Feel free to make the most of any event opportunity that you may find interesting. If we click on this, we'll be redirected to some upcoming like publicly available opportunities and events related to the disease, which is this one is Ask the Expert, hosted by the Diabetes Organization of America. So if a patient feels the need to register, they can register and utilize it. So yeah, all kinds of information to help them being engaged, more well informed, and improving their lifestyle. Once the patient is done, they can simply log out. With that, we'll quickly jump back to our presentation and look at the remaining few slides. The last, second to last, is the project status and Gantt chart. Of course, the project status is complete. There were a couple of areas in coding and integration. Since I'm a first-time programmer, I went over a couple of days with those activities and tasks, but it did not affect the overall timeline of the project, and everything is complete. And lastly, the future plan or opportunities. Of course, this application was a prototype and can be extended to have many more features and functionality in the future, such as support for content in multiple languages, tie-up with third-party providers, resources for financial assistance for patients who do not have insurance, resources for legal avenues for patients requiring legal help with their chronic illnesses and treatments, and a module for a simplified medical dictionary that would give patients more information about their prescription as well as over-the-counter medicines if they want to know more about those things. So yeah, that was my presentation. Thank you.